Welcome to this short introduction to health literacy. My name is Karen Storms, and I'm a library and information specialist in the Northern Care Alliance. To get us started with the context of health literacy, in England, about 7.1 million adults read and write at or below the level of a 9 to 11-year-old in this country. If we think about numeracy skills, the ability to do maths, the number is higher. Why is low literacy and numeracy a problem for you as someone who's taking care of patients? Adults who have these low skills and the children of these adults suffer the lowest health outcomes in our country. There are several definitions of health literacy. This one has been adopted by the World Health Organization. Health literacy is a person's ability to access, understand, and act on health information. Health literacy levels change depending on circumstances. Trish Greenhalgh, professor of primary care, guru of evidence-based medicine, confirms systematic approaches forgotten at a time of peak stress. Poor health literacy is not just about having low skills, although this is one of the most basic barriers to good health literacy and good health outcomes. Most people will have health literacy needs at some time in their life, regardless of their skill levels. For example, when they're under stress, when becoming a new parent, when getting a frightening diagnosis. Information may need to be presented more simply, in stages, when we're able to process it. This needs to be taken into account. We need to make more personalized approaches. In the previous slide, we talked about some of the personal impacts. Low health literacy is expensive to individuals, to healthcare providers, and to society. An American modeling estimated that low health literacy costs the U.S. economy between $106 billion and $238 billion annually in the form of additional healthcare required and sick days pay. The knock-on effects of low health literacy for future generations can be calculated in the trillions. Swiss authors calculated that low health literacy raised the total national healthcare budgets by an extra 3 to 5%. In the NHS, an additional 3 to 5% to the NHS budget equaled 5.7 to 9.6 billion, and that was in 2020 to 21. This does not take into account the wider economic implications, such as lost income tax revenue due to lost years of productive employment. Improved health literacy can save time for both you as the practitioner and the patient, improve your practice, improve patient care, improve patient satisfaction, improve patient safety, and ensure the most effective use of resources. In other words, save money. How can we support improved health literacy? Simply put, by improving the information we provide to patients. Ideally, this is taking place at the same time as initiatives to improve health literacy standards for all patients, especially those from the most disadvantaged groups. This improvement starts by considering the way we write health information. Ways to improve our written communication with patients include using short sentences, 15 to 20 words max, using short, simple words, avoiding jargon and abbreviations, addressing one idea per sentence, writing numbers as figures instead of words, using as large a font as practical and professional, involving users in the process. This means asking for communication feedback, making sure all health information literacy is evidence-based. If you need help getting your evidence up to date, book a session with one of the librarians. Here are some examples of keeping communication vocabulary simple. The word modify is really change. Hypertension is high blood pressure. A positive or negative result is a good or bad result. A fever is a high temperature, and a topical medication is applied directly to a part of the body. Another tool we have is Teachback. This is a way you, as the healthcare provider, can make sure you have explained the information clearly. This is not a test or a quiz to give patients. Start by asking the patient or a family member to explain in their own words what they have to do in a caring way. This is a way to check for understanding and, if needed, re-explain and check again. This technique is research-based health literacy intervention that promotes adherence, quality, and patient safety. You may have a number of key points to get across in your interaction with a patient. You can try chunk and check for this. Break the information down into small chunks and check for understanding between the chunks rather than waiting until the end. For example, you have 2 different tablets for this patient. Explain the first tablet, when it needs to be taken, with or without food, and check for understanding before moving on to the second one. In summary, health information is too complex for the majority of the population in England. People with lower health literacy have poorer health outcomes. By making communication clearer, we can improve health literacy. There are proven techniques to help, like using simple language, teach back, and chunk and check. Thank you for joining me for this short introduction to health literacy. My name is Karen Storms. I'm part of the Library and Knowledge Service. And if you have any questions, please email me directly or library@nca.nhs.uk. Please look at the next slides, though. There's a lot more resources available. Here are more resources to help with writing health information. Here is more information about TeachBack. Here is more information about chunk and check. Here is more information on health literacy.